It's hard for us to believe that in this day and age, a woman having a caesarean section would receive no pain relief and no anaesthetic. But this is a story of a woman in a remote Congolese village in 2023. The doctor performing the caesarean section didn't have adequate training and so didn't give her any pain relief or anaesthetic because he thought it would harm the baby. There are far too many complications like this in poorly performed deliveries and surgeries, and often patients are referred to AusHEAL Africa Hospital to repair the damage that's been done. A survey in 2 health zones in the region noted that 35% of households had someone in their house that needed some form of surgery, obstetric, trauma, or anaesthesia care in the preceding 12 months. But 1 in 3 of those people did not go to their local health centre because they were worried about the standard of care they would receive. Doctors from these regions each care for an average of 60,000 patients. In comparison, even in remote areas of Australia, 1 doctor may look after 1,200 patients. It's stories and statistics like these that motivate AusHEAL and the specialists at AusHEAL Africa Hospital to help train and equip these rural doctors who otherwise would be far from help and far from the training that they need. In 2023, AusHEAL, in partnership with AusHEAL Africa Hospital, began a 2-month diploma in SOTA care to train rural doctors in surgery, obstetrics, trauma and anaesthesia. The SOTA course is largely taught by AusHEAL Africa specialists who gained their specialisation through previous AusHEAL scholarships. When the doctors start the course, their existing knowledge is tested and they rate their knowledge of anatomy, physiology and basic medical skills quite low. This is because medical training in the Congo has very little, if any, practical training. Throughout the course, the participants are taught how to tie knots and sutures, how to deliver babies safely, and how to administer different types of anaesthetic. Many of them have never been shown how to do these simple things correctly. The teaching of basic surgical skills and trauma care are just 2 key components of the training, but there is a lot more they learn in their 2-month exposure at AusHEAL Africa. When they leave the course after 2 months, their knowledge and skills have improved. Their test scores go from an average of 58% to almost 80%, with some getting over 90%. On a 0 to 10 scale, their knowledge in anatomy and physiology goes from 5 to 8. Their overall ability and skills goes from 5 to 8, and their ability to resuscitate a seriously ill patient rises from 4 to 9. They are also able to contact the specialists at AusHEAL Africa to ask for help and advice once they return to their villages. Dr. Morrow is one of the doctors who participated in the SOTA care course. He comes from a village with a basic hospital that provides healthcare to 114,000 people in their district. He reflected before he started the course that people who came to the hospital with severe trauma often died because of the lack of training and education. On the weekend that Dr. Morrow returned to his village after completing the course, a patient came in with severe abdominal injuries from a car accident. Dr. Morrow knew that he would have to perform some surgery, and when he opened the patient up, he found that his liver had been torn and there was excessive bleeding. Because of the training that he had received through the course, he knew how to repair the liver, and because of this, the patient lived.